Boarding alarm. The gate agent scans your pass, frowns, and asks the 6 words that can end a trip. Do you have a fit-to-fly letter? In that instant, your vacation, your wedding, your business deal, all of it hangs on a single sheet of paper you didn't know you needed. Today, we're diving straight into the 10 moments airlines most often ask for that letter, so you don't get turned away at the gate. We'll hit pregnancy cutoffs, newborn rules, recent surgeries and fractures, contagious illnesses, oxygen and medical devices, lung and heart issues, ear and sinus problems, and cases where you're traveling specifically for medical care. You'll also get a simple checklist for what the letter must say, when to send it, and 25 twists that catch travelers off guard. Miss one detail and you could be rebooked or refused. Nail it and you breeze on board. Picture the letter as your boarding pass for your health. It's written by someone who actually treats you, your primary doctor, surgeon, specialist, or midwife, not a friend who happens to be a nurse. The core of the note is simple: who you are, your condition, that you're currently stable, and that you're fit to travel by air on specific dates. It should mention any limits, like needs aisle seat, can't lift luggage, or avoid stairs, medicines or equipment you'll carry, and, if relevant, device make/model and how it's powered. Some airlines accept a straightforward doctor's letter. Others want their own medical form, often called a medical information form, or MEDIF, filled out by your clinician. Think of it like the airline's checklist. Same facts, but on their paper. If you need in-flight oxygen or you're requesting special assistance, stretcher, medical escort, expect the formal form. Timing matters. Many airlines ask you to send the letter or form a few days before departure so their medical team can review it. If your situation changes, new symptoms, new meds, get a fresh note. Keep a printed copy and a phone photo. At the airport, confidence is everything. Present it before anyone has to ask. Belly check. Boarding pass. Pause. After 28 weeks, many airlines want proof you're okay to fly. Your letter should spell out gestational age, due date, whether it's single or multiple pregnancy, that it's uncomplicated, and that you're fit to travel by air through your return date. Expect hard stop lines close to term, often 36 to 37 weeks for singletons and earlier for twins, with some carriers stricter on long haul. If you've had bleeding, high blood pressure, or preterm labor symptoms, get a fresh note. Pack your prenatal record, request an aisle, walk and stretch, hydrate, and wear compression socks. No exit rows. Bump plus belt room matters. The gate agent spots the tiny knit cap. How old is the baby? Many airlines won't board infants under about 7 days without a clinician's note, and premature or recently hospitalized babies may need extra review. Your letter should confirm date of birth, term weight, stable vitals, feeding well, no respiratory issues, and that the infant is fit to travel by air. If you delivered days ago, especially after a C-section or with complications, carry your own clearance too. Bring a birth certificate or hospital discharge summary. Plan to feed during takeoff, landing, to help ears, and request seating that allows easy aisle access and diaper changes. Hospital wristband still on, that's a red flag at the gate. After any recent illness or procedure, airlines want proof you're stable and not at risk mid-flight. Your letter should name the diagnosis, procedure, the date it happened, current vitals, status, no fever, pain controlled, any restrictions, no lifting, needs aisle, meds you'll carry, and the magic line, fit to travel by air on your flight dates. Fresh chest/abdominal surgery, concussion, recent ER visit, or a flare-up that required IV meds will all draw questions. If you're still changing dressings, using crutches, or on new anticoagulants, bring the note and pack a plan. Walk, hydrate, and ask for early boarding. Wheelchair tag on your crutches and a fresh cast, expect questions. Cabin pressure can worsen swelling, so most airlines want proof you're stable, often after a short wait, roughly 24 hours for short flights and 48 hours for longer ones. If the cast was applied today, ask your clinic to bivalve, split the cast to relieve pressure. That little detail calms gate agents fast. Your letter should note the injury, date of casting, pain control, no neurovascular compromise, and that you're fit to travel by air. Full leg cast, you may need to buy an extra seat to keep the leg elevated and avoid blocking the aisle. Rash, fever, or a fresh diagnosis? Airlines can stop boarding if you might be contagious. Your letter should state the illness, treatment status, and that you're no longer infectious by airline and public health standards. For rashes like chickenpox, the note should mention lesions scabbed over. For bacterial infections, that you've had adequate antibiotics and are symptom controlled. For viral illnesses, flu, COVID, RSV, that your fever is gone and symptoms are mild and improving. Include any needed precautions, masking, hand hygiene, and confirm you're fit to travel by air on the listed dates. Print it and keep a photo ready at check-in. Beep from a carry-on. Agent looks up. Is that medical equipment? If you use a portable oxygen concentrator, POC, or plan to run CPAP/BIPAP in flight, bring a letter that lists your diagnosis, device make/model, required flow/rate or settings, and confirms you're fit to travel by air. Most airlines expect batteries for 150% of total travel time, gate time plus flight plus connections. Pack spare batteries in carry-on, taped terminals, and proof the device is FAA airline accepted. Include whether you'll use the device during taxi, takeoff, and landing. If you only use CPAP for sleep and won't power it on board, say so. And note it's an assistive device. Short of breath at rest, a recent collapsed lung, pneumothorax, or an acute flare of COPD/asthma puts you on airline's radar fast. Cabin pressure changes can worsen trapped air and strain already irritated lungs. Your letter should confirm resolution on imaging, if applicable, stable oxygen levels, current medications, and whether you'll use a POC in flight. Add the line, fit to travel by air, for the exact dates. If you were hospitalized for pneumonia or COVID recently, make sure the note states you're clinically recovered, able to walk the aisle without distress, and have a plan for hydration and movement to protect against clots. If your wrist still wears a hospital snap from a heart attack, stent, arrhythmia fix, or heart surgery, expect extra scrutiny. Your letter should list the event procedure and date, current vitals and meds, especially blood thinners. Exercise tolerance can climb one flight of stairs without chest pain, and clear no chest pain, no new symptoms language. Add whether you have a cardiac device, pacemaker, or ICD, and any airport screening notes. The closer your flight is to the event, the more important the letter. Finish with fit to travel by air and practicals. Aisle seat, stretching plan, and carry nitro/meds in your personal item. Nothing ruins descent like blocked ears. If you've got ear infection, bad congestion, sinusitis, or recent ear surgery, pressure changes can be agony and risky. Your letter should confirm no active infection, cleared to fly, and if post-op, that your surgeon says the ear can equalize. Include simple tactics. Nasal spray before takeoff, landing, chew, swallow, Valsalva, gently, hydrate, and avoid flying with severe blockage. For kids, note any ear tubes. If symptoms worsen mid-trip, your letter plus over-the-counter decongestant guidance can save the return leg. Clear passages, clear note, and you're good to go. If you're flying for treatment or need a stretcher, medical escort, wheelchair, aisle chair, or specialized seating, airlines route you through their medical clearance teams. Your clinician's letter should state the diagnosis, why travel is necessary, mobility level, equipment needs, and any infection control. Add oxygen needs, battery plan, and whether you can sit for taxi, takeoff, and landing. Expect dedicated forms and quotes for extra seats or stretcher setups, plus ground handling coordination. Pro tip, request bulkhead or movable armrest seating if transfers are hard. With the right paperwork, even complex trips can run smoothly. Think like a gate agent scanning for green lights. Your letter should hit these essentials: identity plus itinerary, your full name matching passport, record locator if available, travel dates, and flight numbers, diagnosis/status, plain English summary, why it's stable now, and relevant dates, surgery, delivery, recovery. Fitness line, exact words, fit to travel by air, covering all flight dates, including the return. Risks, limits, mobility limits, lifting restrictions, need for aisle or extra leg room, no exit rows if mobility limited or pregnant. Meds, equipment, list prescription meds in carry-on. Name device make, model, POC, CPAP, settings and battery plan. Infection status, if applicable, no longer contagious, symptoms improved, safe to fly. Contact info, clinician's name, specialty, practice address/phone/email, and signature on letterhead. Timing, date of exam and letter issuance within a reasonable window of travel. Attachments, optional. Discharge summary, imaging confirmation, e.g. resolved pneumothorax, vaccination proof for newborns if relevant. Short, specific, and on letterhead beats a vague paragraph every time. Clock management saves trips. Use this rhythm, T-14 to T-10 days. If you anticipate issues, pregnancy greater than or equal to 28 weeks, new cast, oxygen/device, recent hospital stay. Book with time to spare and check the airline's medical page. T-7 to T-5 days. See your clinician. Get the letter on letterhead. Signed with all details above. If the airline requires a medical information form, bring it so your clinician completes it once. T-5 to T-3 days. Submit via the airline's portal or medical email. Keep your sent email. Ask for written confirmation that your documentation is accepted. Screenshot everything. T-48 hours. Recheck your status. Any new symptoms? Update the note if needed. Pack printed copies plus clear photos/PDFs on your phone. Day of travel. Put the letter with your passport/ID. Present it proactively at check-in, not just the gate. For connections, assume each checkpoint may ask. Have it ready again. If anything changes mid-trip, new cast, ER visit abroad, repeat the cycle before flying home. Same sky, different rulebooks. In 2025, expect stricter documentation when devices or batteries are involved, more digital submission portals, and some carriers aligning closer to IATA-style forms for complex cases. Pregnancy and newborn thresholds look similar across many airlines, but the wording and proof they want can differ. Some ask for due date plus uncomplicated status. Others want gestational age and exam dates spelled out. Oxygen policies vary. A few carriers rent onboard oxygen. Most require FAA-accepted POCS with ample batteries. Clearance for stretcher/medical escort is never standard quotes. Aircraft type and route all matter. The rule of thumb: the operating carrier's policy wins, even on code shares. Check it before booking, not after paying. Run this pre-flight drill. Pregnant greater than or equal to 28 weeks? Get a letter. Infant less than 7 days? Get a letter. Recent hospital surgery injury? Get a letter. Contagious or just recovered? Get a letter confirming not infectious. Oxygen/CPAP/POC. Letter plus battery plan. Lung or heart event recently? Letter. Ear, sinus trouble, or ear surgery? Letter. Medical travel/special setup? Letter plus airline forms. Here's the takeaway. Surprises kill trips. Paperwork saves them. If any of today's 10 triggers apply, secure a tight, specific letter and submit it early. Carry print and digital copies, present confidently, and you'll glide past the questions others stumble on. If this helped you travel smarter, like this video, subscribe and share it with a friend who always wings it at the airport. Your future self, smiling at the gate, will thank you.